We are doing this one more time. The last one, we had a little kerfunkel, but here we are. And I think we're back on. Everything looks good. So, like I was saying before, we're going to start from the beginning. So, welcome back to the channel and this series, All Things Mental Health. This week, we're going to talk about a little bit of a serious and possibly triggering topic, suicide. And we'll talk about recognition, ways to like decrease the risk, warning signs, the whole nine. And this All Things Mental Health is a part of a series. I originally did it on Udemy, and now I'm making it available as a live stream so that people could interact, do comments, talk, discuss, and essentially it's the basics of like most, the most common diagnoses. And then also we're going to talk about like how to identify those things, what are some of the treatment options, what are even some apps you can use. And then the second part of this series will be how to get help and what to expect when you get help for yourself and loved ones. So it's going to be a good series. If you like what you see, please like. If you haven't already, please subscribe. And also hit the notification bell so that you can hear when I'm going to do new lives because they're not consistent yet. They have been weekly, sometimes twice a week, but so you can stay up on top of it and be on top of the series. It's probably best to click the notification. So last time we had some issues with PowerPoint and the mic, but I think we have fixed that. And so we can get started with our lecture about suicide. All right. So, like with the other slides for this lecture, we'll have what people might come in and say when they're having these types of thoughts. So, for our discussion about suicide, some people may say, I can't live like this anymore." I want you to notice straight out that this doesn't say, "I want to kill myself," because more than likely, people aren't gonna just say that. Some people will. Some people will. Um, but a lot of times when someone is having suicidal thoughts, they're coming to me saying, "I just can't live like this anymore. I can't. This is too much to bear." Even vague, more vague things like, "I'm just so tired. I'm tired." That is, in a way, um, those are some ways that people are expressing that they're having suicidal thoughts. So let's talk about why this is important first. So suicide, 90% of people who died by suicide had some type of mental illness. So it is very much linked to some type of diagnosis. Suicide is also the 10th leading cause of death among adults and the third leading among adolescents. So there are some risk factors, and we kind of talked. We didn't kind of talk. We talked about this in the lecture which was believe the quotations was "Why me," where we talked about how certain illnesses, diseases, disorders come about, and even with suicide, there are modifiable and also non-modifiable risk factors. So modifiable are things that can be changed, include substance abuse, access to firearms and weapons, isolation, sleep deprivation, limited engagement with supports, limited engagement with treatment providers, especially if some type of diagnosis has been made. And then there are non modifiable risk factors: having a psychiatric illness in itself, having some type of chronic medical illness. So, this is something that could be like a general medical condition like hypertension, diabetes, cardiac disease, or heart disease is a big one. Gender, trauma, adolescence, being an adolescent or being elderly, that's not really modifiable. A recent loss. Family history of suicide is a big one. If someone has a family history of suicidal behavior or a completed suicide, that is a risk factor. And then, of course, well, not of course, but past self-harm and past suicide attempts in themselves increase the risk of someone attempting or completing suicide. So let's get into some of the warning signs. And as we talk about the warning signs, I do want to make sure that we also distinguish, you know, whether the preventability of suicide, because it's a fine line topic, because in many ways suicide can be preventable, and that's why we're even talking about warning signs, what have you. But at the same time, for those who have lost someone to suicide, I don't want you to carry that burden that that wouldn't have happened, or that person would have attempted, or that person wouldn't have completed if I did something, taking that onus. Even it's even hard for me as a provider and other providers, that we have to understand that too. That in as so much as we do want to help people recognize, have the warning signs, it's not something where you can take that responsibility if someone did end up completing suicide or attempting suicide. Very fine line, I know, but I just want to encourage people that have that burden on them to kind of release that, because in as so much as we can help, and we can help people not to, it's not something that we could control, unfortunately, 100%. So here are some of the suicide warning signs. Um, Number one, threats or comments that people want to kill themselves, and this is known as suicidal ideation or suicidal thoughts. I don't, yeah, I don't really go into it in depth in the slide, but I'll explain it now. There are different levels of suicidal thoughts. There's what we would call active thoughts and passive thoughts. So active thoughts are, I have a plan and I intend on killing myself. That's what we would call active. But just as dangerous can be passive thoughts, where I don't have a plan, I don't want to kill myself, but I have thought that life would be better without me here, or life is too hard for me to live. So even though that's not someone overtly saying that they want to kill themselves or that they want to hurt themselves, it is a warning sign if someone is talking about, people would just be better off without me, or things are just too hard to bear. I don't know how I would deal with this. That type of thing can be a warning sign. Another thing is increased alcohol or drug use, aggressive behavior, being socially withdrawn from family, friends, and community. That could be like a warning sign, like if you're not seeing someone. I mean, another thing to think about is these are also warning signs for some psychiatric conditions, uh, regardless. So if you see some of these could just be a warning sign that somebody isn't doing well emotionally, and their mental health is kind of impaired. So we're talking about social withdrawal from family, friends, and the community, dramatic mood swings, preoccupation with death, like talking about death or dying a lot, and then if someone is engaging in impulsive or reckless behavior. So the biggest thing for this is, if you see something, say something, right? If it's to the point where you feel like a person is in imminent danger, you saying something would be to let a crisis center, or calling 911 and explaining the situation fully to them. Or it could just be as simple as, let's say it's not to that extent where you think they are immediately about to do something, but you're kind of concerned about that person. Talk to them. Say, hey, I'm hearing you say these things. How are you feeling? Like, let's check in. Do you need more support? Like, what's going on? Like, how are you feeling? And in that could be therapeutic and helpful. All right. So this is fairly new, in that, well, not fairly new. I don't know how new this syndrome is, but my good friend Adrian, she brought it to my attention. They had a New York Times article called "When People in Distress Deny Being Suicidal, Should They Be Believed?" And then Psychology Today They did an article about when patients deny being suicidal, are they being truthful? And essentially, both articles were discussing this new, not new or newer way to conceptualize suicide and suicide prevention, which is suicide crisis syndrome. So this is like hot off the press, December 2025. Something I think everyone should look into. But I just wanted to give some like key points from those articles and what they were saying. So there, I think the basis of this is that in addition to people having warning signs, there are even more signs that a person could know imminently that they might be feeling like suicidal and more likely to act on it. So, for instance, um, people they polled a few people that were suicide survivors and asked them, "Tell us about the time like the hours, minutes leading up to the attempt and tell me kind of what you were feeling." And this is how they got this suicide crisis syndrome. So this can happen to anybody. That's why this is important. This can happen to anybody. You do not need a psychiatric condition. Actually, for the warning signs before, you do not need a psychiatric condition whatsoever. You do not need a diagnosis to even consider or complete suicide. So that's why this is so important for all of us to think about if we see warning signs in anyone, even someone that we know is normally to be jovial or happy or content. Still, if you see something, say something. But this is the take home for this is if you feel something, say something like, I feel this way and this is not my norm. I should probably reach out before I do something that um, is fatal or that I'll regret. So let's go through we're going to go through the three domains. So core emotional and cognitive symptoms. So intense psychological pain like unbearable feelings of anxiety, depression, despair, feeling trapped or unable to escape. Cognitive constriction, so like very like rigid in thinking, really all or nothing, very black or white. It's either this or that. And with when it comes to behavioral or psychological signs, this is agitation, like just this restlessness, like this inner restlessness, not sleeping. I cannot reemphasize enough how important it is for people to sleep. You need to sleep. I don't care what's going on. Part of treatment is going to be rest and sleep. You have to sleep. If you're going more than a day or two without sleeping, please contact somebody professional to get help with sleep. Sleep is so important, it's non-negotiable. But that is also a risk factor. I didn't sleep for days. I was so agitated. That was part of these people's crisis syndrome, and also impulsive or frantic behaviors. And then when it comes to warning signs at immediate risk, like imminent, not immediate, but imminent risk, like, now I really need to start talking to somebody, is a sudden escalation of distress. Like, overwhelmingly, it just comes across you. Don't just ride that wave. Try to find someone, talk to someone, help crisis line, somebody during this time. This is the time, this is go time to do some action. Then we have inability to tolerate emotions. Like, I just cannot feel this right now. When things just feel like way too much, it's time to come out of yourself and try to seek help. And then statements reflecting urgency or desperation. More, again, capitalizing on, I just really can't do this right now. This is just too much. All right, so I'm going to look at the chat and see if there are any questions, anything that may have came up. And like I've said in other chats before, or at other live streams before, even if you see this in retrospect, please come back and comment in the comments, and I'll go back, and other people can comment too. It's a community. We want to help each other. I'm going to be right back. Give me 1 second. I'll be back, and then we will do the second part of the talk. All right, I'm back. Okay. All right, I don't see any questions, and so we will continue. All right, so then, even though suicide in itself, did I put the, let me make sure I put the, no, I did not. Put the slide back up. Even though suicide in itself is not, um, or suicidal thoughts is not like its own diagnosis, the treatment or the recovery in it will revolve around um, stress relief and or symptom management from other diagnoses. So let's assuming um, that the suicidal ideation is a symptom or manifestation of uncontrolled symptoms. So like you're just having worsening depression, worsening anxiety, worsening of whatever diagnosis you have. The medications will be to control whatever that diagnosis is. So antidepressants, mood stabilizers, antipsychotics, what have you. Another thing is therapy. Therapy will be very, very similar to and geared to whatever diagnosis you already have, or just in general, you could just go to therapy. Like, I'm having these thoughts. I really don't have a diagnosis per se, but I have these things that I want to kind of talk through. Because in as so much as medications can be helpful, there are certain conditions that medications don't treat. And we'll get to that. Medications can be helpful with those diagnoses just because um, they co-occur or they occur with other diagnoses that need medications, but there are some mental health conditions that can't be treated with medication. So I would say even if you're feeling suicidal, if you're feeling like your life isn't worth living, I feel like that is worth a visit to a therapist or someone to talk out things with. It may not necessarily be you may not need the medication management part, but definitely think about the therapy part. And if you have a good therapist, they will refer you to a psychiatrist if that's needed. And of course, exercise, nutrition, meditation, always helpful for everything. And last but not least, safety planning. So I tell, and this is the same, I tell people to go to this site, and this is the same site that I use when I'm doing safety planning with my patients is mysafetyplan.org. So you go in there and then you click, I guess, get started or start. And from there, you will fill out a list of questions. And then at the end, it'll give you an option to either download your results or have them emailed to you. I always download them instead of emailing them, but it's up to you. So let's go through what my safety plan will guide you through. And even if you're having some thoughts now, you're watching this, no judgment. You can kind of think about these the answers to this for yourself. The reason why safety planning is helpful, it's not a contract. It's not saying like, hey, I promise not to kill myself. What it is instead is something that you will have readily available, either printed out or just on your phone or something that you could retrieve from whatever media device you have to say in those times of crisis, in those times of hopelessness, in those times of like high urge, because you could use this not only for suicide, but like self harm. In those times where I'm feeling kind of out of control, I can look at this and see that I have options, I have resources, I have a plan. Because when you're in the thick of things, that's the last thing you have is a plan. But with this, you can say, I have a plan. We are planning. All right, so let's do this plan now. So the first thing we're going to think about are my warning signs, right? So how, like, what are some things that when they happen, you know that suicidal thoughts or thoughts of self harm may occur. So let's think of some things. So like uh, and the good thing about mysafetyplan.org is they'll have a list of at least 6 things that you can like choose from. So sometimes it could be my warning signs are I feel very fatigued, or I feel very anxious, or my heart is racing, or I stop eating, or I withdraw from others. Start thinking about how you physically feel and are some things that you do or think when or prior to suicidal or self harm thoughts come. My coping strategies. So, what can you do on your own to stay safe? This is by yourself. This is not. I think one of the suggestions says like call someone to do. No, I want you to think about something that you can do on your own. So, a coping strategy could be sleep, which I'm not crazy about as a coping strategy. A lot of people will say sleep, but hey, if that gets you through, if that gets you through the time and you can look at your safety plan and say, "Yep, time for a nap," take it. I'll take it. That's a win. So sleep is a big one that people try, that people will put down. Journaling is one that other people will do. Some people will also say meditation. Some people will say distracting themselves, like going for a walk. All right, so distractions. Speaking of distractions, which people or places help you take your mind off of your problems at least for a while? Who makes you feel better when you're socializing with them? And this is not who you're going to. Distractions are good because this isn't who you're like investing your heart and your vulnerability into. This is like, who can I talk to, get a good laugh? What channel can I go to and I'm gonna be cracking up, or I'm gonna be distracted, or I'm gonna be like in the zone? Where can I go where I'm not worried about what's going on? I'll just go outside or go to the gym or, what are these distractions? What can distract you? Pets. Pets are great. They're great distractions. So this is the things that these don't have to be that serious. These are the things that are going to just get your mind off of things, kind of help you regroup. Now, the next category of people are supports. This is more than just, a distraction. Who do you feel you can talk about what you're experiencing that can be supportive? Who can you disclose this to that you know will be supportive to you? Usually, this is family members, friends. Who can you call in a crisis? Um, Listing multiple people is good. Um, at least 3 people, 2 to 3 people. If you don't have that, we'll talk about the next step. But listing the people, their names and their numbers, and even their relationship. Not like you don't know, but it's good to just have it there and remind yourself, like, I have these people. These are my people. And then, everyone doesn't have social supports, and they have to kind of rely on professional support. Right out the gate, you're going to put 988 there. You're going to put the suicide prevention hotline there. But we'll talk more about 988. But 988 is like you can dial on your phone, you can text it, you can even do a chat with them online. Like, bam, that should be like number one. Everyone in America can use that. Even if you're not in America, there's the next thing that you should always have is the local crisis number. And I think it's good to call like crisis numbers and hotlines just because they are professionally trained to help people who are having suicidal thoughts or thoughts of self-harm or just need somebody to talk to. There are literally like hotlines where I just need somebody to talk to, and I just want to kind of destabilize a little bit. And then after you do those kind of not generic, but those things that almost everyone get kind of personal. So like your therapist, your psychiatrist, um, your coach, what have you. And then next would be a safe environment. How can you make your environment safe, especially with people with self harm? This is a big one. Removing scissors. It could be that serious. You should not have scissors around. You shouldn't have razors around. You shouldn't have knives around. If you do have guns, you should have maybe consider having someone else hold them. Being when we talk about safe environment, maybe not even being alone, making sure you're in common areas, leaving the house, that type of thing, or staying in the house because you have thoughts of doing something, harmful externally. So, what will make it harder for you to have access to means or access to things that can harm you? And then, after you fill all these out, have them written down somewhere, have it printed out, have it easily accessible as a PDF. You want it there to know that you have a plan, that things are not helpless, and that all hope is not lost. Even when you feel hopeless, you have a plan, you have something you could turn to. So let's talk more about those resources. Okay, so like I said, there's 988. There's also, we call it lifelines. There's also 1-800-273 talk. The American Psychiatric Association also has a crisis center, 1-888-35-PSYCH, when I have the numbers, what they mean. And then the Psychological Association also has an educational line. And then in terms of apps, like I said before, 988 provides immediate access to trained crisis counselors via call, text, or chat. So if no matter where you are in the United States, 24/7, you will be able to get to those people. And then in the show notes or like the links, when I update it, I'll have the links for iPhone and Android to get to these apps. And then I'll also have the links for my safety plan. Then there's MY3, is a suicide prevention app focused on personalized safety planning. So kind of similar to what we did with my safety plan. Stanley Brown's safety plan. This is an app digital version of the gold standard. A lot of people have done this in their therapy office or their therapist's office, and it's basically also what's outlined in mysafetyplan.org. There's Wobot, and we've mentioned them I think last week, which is a CBT-based mental health chatbot designed to support users experience depression, anxiety, and distressing thoughts. And then last but not least, Mood Tools is designed for individuals with depression and includes mood tracking, coping strategies, educational resources. It also contains safety planning. All right. Um, so thank you for joining me in this discussion. So you can see me. Thank you for joining me in this discussion. Um, like even though we're talking about risk factors, preventability, I do think that it is preventable. Um, I don't want anyone to think or have that burden that I did not stop someone from those actions. I do have some comments. Um, so one of the comments asks about what do you do about ongoing suicidal thoughts, which is a thing. Some people on an ongoing basis have struggles with suicidal thoughts. Like just at a baseline level, they have thoughts of either hurting themselves, killing themselves, or thinking that life is not worth living. What I would say to help them if it's ongoing is that I think that is worth um, that is worth recommending or seeking treatment, such as therapy and or medications and or both, because it's a very hard place to live. It's very hard to live like that. It's very difficult to live like that. It's very difficult to function like that. So at the end of the day, like the point of this whole series is for people to kind of get their lives back and to get their livelihoods back and for them to function. So if you're thinking like that on an ongoing basis, it's hard. It's tough. So it really would be best to get treatment, to get help. And it's not even like because you have ongoing thoughts, this is actually an ongoing state. This is something that I'm also trying to like expand my mind and expand the minds of my patients to think that you can be helped and you can recover from these things. You can function again. This doesn't have to be a permanent thing. Even if it's been going on long term, even if it feels like it's been forever, the point of series like these, the point of any any series that's talking about mental health, if they're truly talking about mental health, they want people at some point to feel well and be well. So if it's to the point where it's ongoing, that's definitely a red flag. If you're thinking about this for days, weeks, months, get some help. Go talk to somebody. Process it. It's worth the work. Your life is worth it. That's another thing I want you to know, that whoever you are, your life is worth it. You are worth anybody's time. Your life means so much to this world. We do not live in a vacuum. So it is very, very important that if you are feeling that type of stress, that type of distress, that you get help. Help for all of us. Okay? All right, so this was a little bit of a somber topic, so thank you for sticking with me. I hope it was helpful. If there's any questions afterwards, please message any comments. Please, we're a community. And then like, subscribe, put the notification. We have a lot more coming up for just this series, and then there'll be more series to come. All right, so I'll see you all. Have a great day. Be well. See you.